Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Leukocyte, alkaline, phosphatase, alkaline, phosphatase score. So this is found predominantly in the mature, segmented neutrophils, and the lab score is obtained by assessing the staining intensity in 100 consecutive neutrophils, with each neutrophil score being scaled from 1 to 4. Now, the conditions that result in increased leukocytes in all stages of maturity, it reflects the corresponding increase in the LAP. Now, where is LAP increased? LAP is increased in case of the leukomoid reaction, pregnancy, polycythemia vera. Next, also the multiple myeloma, obstructive jaundice, as well as the Hodgkin's lymphoma. Then decrease in LAP is seen in chronic myeloid leukemia, the paroxysmal nocturnal hemoglobinuria, the sickle cell anemia, as well as the hyperphosphatemia and the aplastic anemia. To learn and grow daily like this, please do subscribe.